Now we're looking at the chin tuck with cervical flexion. So we differentiated this morning about your chin tuck being upper cervical or capital, and then your full flexion, bringing the chin all the way to the chest. So if I start a patient with cervical stabilization just doing the chin tuck, I don't want them to lift their head up off the table at all. I just want them to do the chin tuck. Okay? But once they get pretty good at the chin tuck, now we have to make it more functional, and we actually have to add a little resistance. So the way that we can do that is have them then start in some chin tuck and then initiate lifting off the table. Okay? So start with the chin tuck, and then I'll tell them, all I want you to do is unweight the head. I don't actually want you to lift it off the table, just unweight. If they can do that, 10, 15 repetitions, now I want you to lift the head off the table. Okay, now I might want you to chin tuck and try to lift your chin towards your sternal notch. Okay, if you can do that, now let's try to lift more towards the whole sternum. So you can break it down into little bits and progress through all the different range of motion. Okay? But always start with your chin tuck, because we need to get the chin, the head, the whole skull lined up properly on top of your spine before we start adding the curls. Patients will call them neck curls. Neck curls. Okay? But we need to start with the chin in the right position before we do that. Towel resistance for all planes. So just like we did with our hands, doing isometrics, we can take the towel and resist ourselves. So get in your nice position here with your chin tuck. Now I'm going to push back into the towel, pull with my hand, so it's just an isometric there with the towel, so it's a little harder. And then you can also go through some range of motion, but giving yourself some of that mild eccentric resistance through your range of motion, flexion and extension. Okay. You can do the same with rotation. So I can resist rotation with my towel, and I can also give some eccentric resistance through some range of motion. Okay, same thing with lateral flexion, I can give some resistance. So by using the towel, that frees up your hands just a little bit. You're not just pressing with your fingers, and you're able to resist through that range of motion. Okay, so then for extension, same rules apply as far as the chin tuck position and such. Your manual muscle test for extension was in a prone position. So you can actually just have someone prone on elbows and just work on lifting their head up. So you can start with a retraction and just say, all right, just lift up. If they're not able to fully get prone, you can just have them on the counter. And I'll have somebody on the counter and say, all right, just let your eyes hang down, and I just want you to lift straight back. Straight back. And then we can work on to the full extension. So now we're going to lift straight back, and then I want you to look up towards the ceiling and back down. So straight back, now look up towards the ceiling. Okay, so if someone can't get prone, you can just have them lean over the counter in a good position and work on that. But break it down into small steps that they can control. And again, we want to start with that chin tuck or that retraction first. All right, so the wedge eccentric. I really like this exercise. Let's see where I have the wedge right here. They make smaller versions of this that are just the foam that don't have the vinyl on top of them, and they make them in different degree angles. This one will work just fine for what we're doing. So remember when we did calf raises, and we talked about doing eccentric exercises that we could go up on both and then slowly lower down and work on eccentric, how much control it takes to do eccentric, that it's a good exercise. We can do the same thing with cervical. So if I were wanting to work on some rotation, so if I'm on this wedge and the right side is higher than the left side, what's that going to do to my head, or want my head to do? It's going to make me want to rotate to the left. If I lift my head from the left into right rotation, I'm going to lift uphill concentrically, right? Mm-hmm. If I control my head downhill to the left, I'm working eccentrically. So I will have a patient lying in hook lying and put the wedge underneath them, and I, as the therapist, will hold their head in neutral and then say, all right, when I let go, I want you to slowly let your head roll to the left. Keyword, slowly. Okay, we get down to the bottom, I lift them back up again. Slowly, lower to the left. I lift them back up again. Or, what I'm doing myself, I can train them to use their own hand and lift up, and then slowly lower down. And then to work the other side, I would move the wedge the other direction. Okay? Once they can control that eccentric, now I can have them start working uphill. I may start with a smaller wedge, not quite as high, and say, all right, now I'm going to have you go uphill. So now you have the hard job. You have to roll uphill. And then slowly lower it back down. Now you're rolling uphill. Okay? So you can do eccentric. You can put them in position. You can teach them to put themselves in the position to do eccentric. Then you can have them start working uphill. Okay, so they make these wedges. If you work in an outpatient clinic, you might have some in the clinic, and you either check them out to a patient to borrow for a while or sell them to the patient. Or I have patients use the heavy-duty 3-ring binders, the thicker ones, and I have them put something inside there, rolled up towel or something like that towards the rings, just to fill it out so their head's not bending it. The cheap ones don't work all that well, but some of the heavier duty ones. So I can have them start with it filled out pretty far so there's a smaller angle, and then we can start taking some of the filling out of it so they're at a higher angle. That works well. You can also use a pretty hardback book and prop it up on one end, so a towel or something, and create your own angle. So that works. I like cheap home fixes, things like that that'll work. So that way you can work on eccentric, and then you can switch to concentric, working on that rotation. Because your body's going to have to relearn, especially after some sort of an accident, a car accident, something like that. Those things are lingering. Whiplash, they take forever to heal. All right, foam roll vertical. How are we doing on time? Not too bad. Let me skip the foam roll for a second, and then we're going to come back to it. There's nothing going on next door. I see a whole rack of foam rollers here. I want every one of you to get on foam roll and lie on it for a couple of minutes before you move on to your next activity. So I will come right back to that one. The pin light or laser stabilization. So stabilization is huge. We need to be able to hold our head in a good position as we do everything through the day. So we can work on these exercises, we can do everything right, and then we go out and do our activities and our body switches back to its normal bad habits and patterns. So we can train someone to hold the head in the correct position using a little pin laser. You can have, we use a couple of different ways, a headband, and you tape the laser onto it. You can use what I told you we use in the clinic as far as the inside of a hard hat type of apparatus. We've used that. There's a strap that goes across the top. We've Velcroed a pin light to the top of it. And then you can have your patient focus in on something. So I would put a Post-it note, or maybe I'd start with a regular sheet of paper and I'd put it up there. And I would have my patient focus on that. So I'm going to say, Brittany, you are my focal point. You're my paper. So if I'm walking, I'm going to keep that laser on your face. My goal as the patient, I can't let my laser focus anywhere outside of the parameter of your face. So I would walk towards you. I have to keep looking at you. Don't let the laser go anywhere. And then I have to walk backwards. Or I have to do some other motion. I had a bowler one time. Crazy neck problems. That's what we did. That was our treatment session. We put the laser light on. All right. In my bowling position, I have to go through my bowling motion, still keeping my laser within that paper perimeter. Then as they got better, I made the paper smaller. As they got better, I made the paper smaller until we were at a Post-it note. Okay? So we can work on that, and it's fun. It's infuriating at times because you look and you do something and then I've lost it. but it's really effective because how else can I make you as the patient realize where you're looking, where your head is facing? So I can do something like that, put a laser light on you, have you go through a motion, and you have to keep that laser light focused in on a certain target. So that works pretty well. And like I said, then you can add in the patient's own activities and say, all right, well, here's what's going on. We do all this work, then you go bowling, and then it all goes to mush. So let's work on this while you're doing those activities. All right, Brian, you said you were going to demonstrate our neck bridge. So very rarely, again, just like with everything else, very rarely do we get to a point where we're doing really, really advanced exercises for the cervical spine. One time I had a wrestler, I had a high school wrestler, and he had to be able to do a neck bridge and not have pain. So we worked on him, got him stable, we worked on him, he still kept trying to wrestle, still kept getting pain. We had to keep upping his exercises to something that was functional for him. So we did a neck bridge. You don't have to. So we had him on a ball, arched backwards with his head, doing his neck bridge. He had to arch forward on the ball. He had to arch sideways on the ball. So I had him doing things that were things that he had to do and stabilizing it. Hold your neck while you're in this position. So it's very interesting to start trying to bring in people's activities and make them really, really advanced. The other thing that we do is like resisted exercises. You may see at a gym if they have the old machine. Most of them, I think, were manufactured in the 70s, where you put your face, you hold on, you put your face in here, and you do this, and then you turn sideways, and you do this, and then you turn backwards, and you do this. And you have to grunt when you do it, too. And you have to wear your tube socks up to your knee and your little tank top, too. But anyway, those are just the guys that I see on them. Yeah, exactly. Those are the guys I see on them. They played high school football in the 70s, and that's how they worked on their linebacker necks. And that's something that you may have to do if you're in a sport that requires that. So you may see that, or you may see sort of a neck harness that you can put on a cable machine, and you'll see some of that as well. I never get to the point where I prescribe that to a patient because normally they're discharged by that time, and then I will tell them if it's not something that you have to do, I would not. I would skip that machine and move on, just because to put resistance on the neck going through a repetitive motion, if you have anything going on in there, a nerve issue, any kind of calcification, you're just asking for trouble. So I would not. And I don't really think they manufacture that machine anymore, but it's a nice little museum piece in a lot of your older gyms. So you might see somebody on it. And they're probably wearing a sweatband too. That's just.
I wear all that stuff when I work out.
I know you do. I know. See, I followed you, and that's why. Okay, so just a little note on here. Any exercise can be a cervical stabilization exercise if you're holding the head and cervical spine in a fixed position while performing some other activity. So just think about that. Just hold your head in the correct position while you're doing your activity. So last but not least, foam roller. I'm going to wheel out this little trolley, and I want everybody to grab a roll.